In this video, we're going to be making a tier list of a lot of different osteoarthritis supplement products for dogs. These are all products that I've used personally with my dogs, either Sadie or Rui or both. And this list is just based on my own personal experience with my dogs. So if you were to give your dog all of these things, you might come up with a completely different list because some of them might work better or worse for your dog. So this is just my own personal opinion. First up, we have omega-3s, fish oil. In addition to being good for the joints, this is also good for the skin, eyes, and heart. The effective dose is quite a bit higher than some people may be using. Most vets will recommend somewhere between 80 to 100 milligrams per kilogram of combined EPA and DHA. You'll want to talk to your vet about what dose would be right for your dog if you want to use fish oil with them. Rancidity and toxicity can be an issue in fish oil, so choosing a good brand is important. Also, choosing a brand that is quite concentrated, if you do want to get up to that higher dose, is also important, just so you're not having to feed an excessive amount of capsules or oil. For many dogs, diarrhea and stomach issues can be a limiting factor as far as how high you're able to get that dose up to, and some dogs may not be able to tolerate a therapeutic dose. Fish and fish oils is also not an uncommon allergy in dogs, so this also may be an issue. There is some of the best research, though, available on omega-3s showing that this does work for dogs. So in dogs that can take omega-3s and can handle that higher dose, this is going to be really, really effective, but it's not going to work for everyone. So because it doesn't work for everyone, we're going to put it in A tier. S is the best and all the way down to D. My dog Sadie was reactive to a lot of proteins, so fish oil was an issue for her, so we had to get other sources of omega-3s. However, our little dog Rui does really well on fish oil, so for him this is a great option. So again, it's just about finding what works right for your dog, and it isn't going to be one size fits all. Next, we'll talk about collagen. So by collagen, I mean hydrolyzed collagen. That's collagen that's been broken down so it can be absorbed and digested by the body. It's good for the joints and connective tissue. It's also good for the skin. This is a little image of Thorne's Thorne Vet Collagen. Thorne makes a lot of pretty good products for dogs. Collagen is a great building block. If your dog has pretty severe osteoarthritis, I also don't think it's going to be something we're going to notice a really dramatic difference. So collagen, great to take. Again, if you have serious problems, I don't expect you to notice a huge difference with this, but you might. So let's go ahead and put it in B tier here. Certainly something good as healthy building blocks for healthy cartilage and connective tissue. This collagen and most collagen sources are going to be bovine based, so just keep that in mind if you're getting collagen. If your dog has any type of bovine allergy, that's something you'll need to be aware of. Going down now to UC-2, that stands for undenatured type 2 collagen. So this is collagen that hasn't been broken down. That's why it's called undenatured. It hasn't been denatured, it hasn't been broken down, it's not able to be digested by the body, but that doesn't mean it doesn't have an effect on the body. So with UC-2, it's actually training the immune system not to overreact to pieces of cartilage in the joint fluid. And this is important because with osteoarthritis, when you have joint degradation, you're going to have little bits of cartilage floating inside the joint from the normal wear and tear and the degradation caused by osteoarthritis. And your body reacts to this, which causes inflammation, which just continues this cascade of problems because osteoarthritis is an inflammatory condition. So UC-2 is training your immune system not to react to it. So it's not fixing osteoarthritis, but it actually is going to slow down that progression because it's going to reduce inflammation by affecting the immune system. There's also quite a bit of good research available on undenatured type 2 collagen and its effect on dogs. You can get some products like here from Now Foods that is just undenatured type 2 collagen. Also, other companies like Pet Jupe make a supplement that has fish oil, undenatured type 2 collagen, and I believe curcumin in it. So you can get some other combination supplements for your dog's joints. And because this is a different type of collagen to the hydrolyzed collagen here, where it has been broken down and will be absorbed by the body, you can definitely use these two together. Even though they're both types of collagen, they are doing very different things in the body. So UC-2, it's actually from chicken cartilage, which my dog was reactive to. Yes, she was reactive to a lot of proteins. For her, it didn't work. For Rui, it works great. So we're going to put it in A tier because much like fish oil, there's a lot of good research that it does actually work. And I've had a lot of clients that have also had good results with both of these. So we're going to put UC-2 in A tier. So now we're going to come to Glucosamine and Chondroitin. This has been recommended for a long time for joints, for dogs, to treat osteoarthritis and things like that. However, while there is some research showing that glucosamine and chondroitin does improve joints in vitro, meaning in a petri dish, there's not a lot of good research showing that it actually works in dogs. In fact, one manufacturer actually lost a lawsuit a couple years back for falsely marketing their products as promoting healthy joints and improving mobility in dogs, as there was no proof that it actually did any of those things. In trials, it has failed to achieve significant results when compared to placebo. If your dog has been taking this and you noticed a big benefit when they went on this, that doesn't mean it isn't working. Science is always evolving, so just because the current research isn't showing that it's working in dogs, it might be working in your dog. All dogs are so different, and there's so many genetic markers we don't understand about dogs and gene expression. So in your dog, perhaps they are able to make use of this, and other dogs aren't. Again, everything I say here is just my opinion. If something is working in your dog, don't let this invalidate your experience. Just based on the lack of research that's available showing that this works, we're going to go ahead and put this in D tier for now. Just because there are other products that are available that have better research, they're going to be in the similar price range. It's not bad to give, and there shouldn't really, other than the cost to you, be any downside as long as your dog isn't reactive to any of the proteins that are used to produce this, which I'm assuming are probably bovine, but I don't actually know. If I really hated it, it wouldn't even make this list. So let's move on. We're going to go ahead and look at Myos now. Myos is the brand name for the canine version of the product Fortetropin. Fortetropin is derived from chicken eggs. So if your dog has a chicken or egg, specifically chicken egg allergy, this could be an issue for them. The goal of Fortetropin is to preserve or build lean muscle mass. So helping to increase strength and muscle mass in dogs with osteoarthritis is a big issue. As they become less mobile and there's more pain, they limit full range of motion, they're going to lose muscle. So maintaining that muscle is really important, and the earlier you can do that, the better. Myos is a pretty popular product with a lot of rehab vets who see a lot of these osteoarthritic clients, along with fish oil and UC-2 also being very popular. Fortetropin has been shown in studies to affect myostatin levels in dogs. So myostatin is going to be what limits muscle mass or muscle growth in the body. So higher myostatin levels is generally going to mean less muscle mass. Lower myostatin levels will mean more muscle mass. You might have seen those bully whippets or certain cattle breeds that are myostatin deficient that look like bodybuilders. So they actually did a study on Fortetropin in dogs. There's a few. There was one in dogs that had TPLO surgery, knee surgery. And over 12 weeks, they gave one group Fortetropin. This group did not see an increase in myostatin levels during this time period, and they didn't lose very much muscle mass. In the control group that didn't receive Fortetropin, or Myos, their myostatin levels rose and their muscle mass decreased. So Fortetropin didn't actually decrease their myostatin levels, but it stopped them from increasing due to inactivity. So this is a great product for a lot of dogs. Again, it's chicken-based. Sadie couldn't have it. Rui likes it. I'm going to go ahead and we're going to put it at the top of B tier here. It could definitely go in A also, I think. I don't know that I've seen otherworldly results from it. We're just going to keep them where they are for now. This is Platinum Performance's Myo-Vet, and this is a canine supplement where the main ingredient is hydroxymethylbuterate. Hydroxymethylbuterate, or beta-hydroxy-beta-methylbuterate, is a product that helps to, again, similar to Myos, maintain and preserve lean muscle mass and build new muscle mass, and actually also to help muscles recover faster as well. So it really helps to improve overall activity in dogs, which is really important because, again, staying active and mobile is going to really help maintain joint health. Joint tissues heal and regenerate under movement. And so if you have inactivity for a long time, or your dog is decreasing their activity because of a loss of mobility and an increase in pain due to osteoarthritis, then that is just going to start a cascade of problems. So this product can help get in front of that. We're going to go ahead and put that also in B tier. That's another good product. Next, we're going to come to Adequan, which isn't technically a supplement. It's actually a prescription medication, but it's been used for a very long time. It's extremely popular with conventional vets, integrative, rehab, and holistic vets as well. It's considered to be quite safe. Side effects are pretty rare. Could be an issue if your dog has kidney disease, though often it will be used with that, so that is not a hard rule. It's just something to generally be aware of. A lot of vets will start this quite early at the first sign of osteoarthritis, because generally it is considered to be quite safe, and it's really going to work to help to preserve joint cartilage in the dog. So if you start this when your dog has really severe osteoarthritis, you may not see the same benefit, because if there isn't very much joint cartilage left or none, it isn't going to be able to preserve what isn't there. There are varying protocols on how this will be taken. The current manufacturer of Adequan, who bought it from a different company who originally developed it, recommends running it in cycles where people will take it, I believe, twice a week for 4 weeks, 8 weeks, something like that. Originally, it was used more frequently where someone might take it every couple weeks consistently. Now they tend to kind of pulse it where you might do, again, that 4 to 8 weeks on twice a week and then take a break for 3, 6, even longer months and then go back and run that cycle or a shorter version of that cycle again. So there's a lot of different ways to do that, and Myo-Vet will know what would be right for your dog, hopefully. It is on-label administered via intramuscular injection, but it's commonly used as subcutaneous injection, and that's something a lot of vets will teach their clients to do on their dog at home, grabbing them perhaps at the base of the neck, above the shoulders, where there's a lot of loose skin, and doing a little quick sub-Q injection there is something that most homeowners are able to do. It is derived from bovine tissue. It's going to be quite a bit more refined down than, say, like a hydrolyzed collagen. It is going to be more rare for a dog to react to it. However, if they have a really severe bovine allergy, this still could cause a reaction for them. If you are aware of a bovine allergy in your dog, you definitely want to talk to your vet about that. It is fairly expensive. It's going to obviously depend on the size of your dog for how much they're taking, but it's quite a bit more expensive than all the other products on this list currently. But I think potentially if I had to pick only one thing on this list, this probably would be what I would pick. So because of that, we're going to put it in S tier, with the only caveat there being that it is a bit more expensive than most of the other products. But that's something where we really noticed a really significant difference when Sadie and Rui started taking it, and that was something we maintained for the course of their life because we saw those benefits consistently, and oftentimes you can see if it's been a certain number of weeks and it's time for their next injection, you will notice a difference in the few days after you give an injection. So this is something where you can really measure the effect, and that helps you know that it's working. So next product is Antinol. Antinol is a capsule that contains a compound that is derived from green lip mussels in New Zealand. The original product was just called Antinol. They now sell it as Antinol Plus with krill added in. I believe in Antinol Plus here, they've actually reduced the dose, though I'm not 100% sure on that. But when I looked into initially, I believe they had reduced the dose of the actual really effective compound that's in Antinol and added in krill. I'm not necessarily against krill, though that is an allergy for some dogs as well, quite a few. So I really do prefer the original Antinol, and I felt like we noticed a big difference on the original Antinol and not nearly as much of a difference on Antinol Plus. The original Antinol was also, I believe, more expensive because it was just going to be more of that effective compound. So we're gonna go ahead and put it in B tier because I did definitely notice a good difference with the original Antinol. Actually, we're gonna go ahead and put the original Antinol in A tier because it actually was quite effective, and we did notice a difference when I originally gave it to Sadie, and when Antinol USA, I want to say is the company, I don't remember, that bought it off of, I believe, Vets Pets, bought distribution rights and then started distributing it with krill added in. That was originally only in the US, and the Canadian market still had the Vets Pets Antinol only version, and I would actually drive to Canada and get that for her, which is a couple hours from us. So I do actually like that quite a bit. So I'm going to go ahead and put the original Antinol in A tier. I'm going to put Antinol Plus in C tier. There's a lot of good reviews on it. I think a lot of people like it. It probably could go in the bottom of B tier. I'm going to put it in A tier just because C tier with the original Antinol in A tier, because I do feel like there is a significant difference between these two products in how we notice them. But again, a lot of people seem to have good results with this, so it's a totally reasonable option to try. The next category here is going to be hormone replacement, specifically testosterone replacement for dogs. Testosterone replacement therapy helps to maintain and build muscle mass, strength, and bone density, which is really important for a lot of older dogs. It also helps with pain as well. Testosterone is also a very powerful anti-inflammatory in the body, which is, again, great for a condition like osteoarthritis in a lot of older dogs. If your dog is neutered or spayed, as the majority of dogs are, then their testosterone levels will basically be zero. So there can be a lot of benefit with supplementing hormone replacement in dogs, similar as you might see with people, with women or men of a certain age, either doing testosterone replacement or other hormone replacement therapies. This is a controlled substance, so this is something that you'll have to do at your vet, and it will be an intramuscular injection that they can do there. There's a company called Dog Osterone, run by Dr. David Bieber, who has developed a lot of protocols and taught a lot of vets on how to use testosterone replacement in dogs. The dose is going to be quite small, and side effects seem to be pretty rare. So this can be a good option for a lot of people who are able to do it. We noticed a really significant difference with this as far as strength and mobility. It was something where you could notice it the next day right away, similar to what we saw with Adequan initially. I'm going to go ahead and put testosterone replacement in S tier as well, with the same downside as Adequan, that it's going to be quite expensive because you're going to have a vet appointment for every single injection. And while Adequan is quite well known by vets, testosterone replacement may not be something a lot of vets are aware of. Dogosterone does have a section on their website where you can look up practitioners in your area, or you could try to call around and see if vets that you know do use it. Some vets will also use it for urinary incontinence as well. The next section is going to be herbal formulas, so Chinese, Ayurvedic, or Western herbs here. And there's a lot of individual herbs or herbal formulas that can be used for osteoarthritis. There's quite a few vets who will use these, mostly integrative or holistic vets, especially Chinese herbs being the most common because of the Qi Institute here in the United States that does a lot of acupuncture and Chinese herb training for vets. So that's going to be the most common one you'll find. That doesn't mean it's more effective than other forms of herbalism. In fact, a lot of them will use a lot of the same ingredients. You might see, say, turmeric used, even though I would say probably originally would be tied to Ayurvedic medicine, used in a lot of formulas, or curcumin, which is the main active ingredient in turmeric. I would say the biggest downside with herbs and herbal formulas is that they can be quite complicated. There can be a lot of other factors, such as does your dog run hot, cold? Do they have other internal organ issues with their heart, liver, kidneys, etc.? And using targeted herbal formulas specific to your dog will really make a big difference, and not just taking this specific herb for osteoarthritis. This means it'll be more complicated for you to use at home without the direction of your veterinarian or a canine herbalist. However, there are a number of vets, again, using Chinese herbs. There's also vets using other types of herbs. You can go to the AHVMA website, the American Holistic Veterinary Medical Association. They will have some good information on finding a veterinarian in your area who will use this, or you can look for integrative vets in your area who will be quite likely to use some form of Chinese herbs. Dr. Donna Kelleher has a YouTube channel, Pet Doc Donna, which has a lot of really great information on using primarily Western herbs with dogs. And Rita Hogan, the canine herbalist, is her website. And she has some good information that's specifically targeted for pet parents as well. There's a lot of good books on the subject, and maybe we will make that a future video. We're going to go ahead and put this in A tier as well. We'll put it at the top of A tier. The only reason I'm not putting it in S tier is just because I think it's going to be difficult to just go online and Google a specific formula for something and not look at the whole picture holistically, which I think is really important with herbalism. So we're going to go ahead and put it in A tier, but really effective. We used a lot of different herbal formulas for a lot of different reasons. Probably used 20 or more different formulas at different times for different conditions, not just osteoarthritis, and found them to be quite effective. So we're going to put that in A tier. Next up is going to be Sigumir and also Gotratik. So Sigumir and Gotratik are both peptide bioregulators. They're developed by Dr. Vladimir Kavinson at the St. Petersburg Institute of Bioregulation and Gerontology in St. Petersburg. So peptide bioregulators are basically derived from bovine tissue, and it's going to be similar to some of these Chinese medicine philosophies that like treats like, where they might give liver for liver conditions, heart meat for heart conditions. This is going to be kind of the modern science refined down version of that. Sigumir is for the joints and connective tissue, and Gotratik is for the muscles. There's not a lot or really any research available on dogs. There's not even a lot of great research available in people. Most of it is coming from Russia or other Eastern Bloc countries where this is much more common. This is something we used with Sadie in her later years, kind of toward the end, once we had already tried all of these other things. And we did notice a pretty significant difference with both of these. In fact, using these as a combination together for osteoarthritis was really effective for us, and something where I noticed the difference within the first couple of days of giving it to her. So we're going to go ahead and put this in A tier as well. I'm really not ranking these within the category. I think I did at one point, but I'm really just putting them within the category now. I'm going to put both of those in A tier. I think, again, the biggest downside is going to be the lack of research and also the costs. They're probably more expensive than everything else here in A tier. And depending on where you're at, there may be different sources available, or it may be harder to source. So We'll go ahead and put this in A tier. Next, we have CBD. This is Myo-Vet, which is a popular CBD company used by a lot of vets because it's run by vets. Perfectly good CBD, but there are plenty of other good CBD companies. This is not necessarily an endorsement of this specific company, though I do think they do a good job. So really the important thing with CBD is just that it is a full spectrum CBD product. I think pretty much all of the products you're going to see now are going to be full spectrum, should be. There's quite a bit of research in humans using CBD isolates, and in fact, in one study they had to discontinue it because it caused so many problems. So definitely want a full spectrum CBD. Again, there's a lot of good options, a lot of good research showing that it helps with pain and inflammation. It may mix poorly with some medications like Prozac. Definitely talk to your vet about that if you're on any medications or just in general. But we're going to go ahead and put this in A tier. CBD is great, and yeah, probably an important part of most osteoarthritic dog supplement regimens. Next up, we have Traumeel. Traumeel is a homeopathic formula from Europe. It's going to contain a lot of different homeopathics, including arnica, but I believe it's about 10 or 12 different homeopathics in here. There are different forms of Traumeel. There are pills, creams, drops. Here I have displayed the ampules. So these are little glass ampules that you'll break open, and this could be given orally, but typically vets will be doing this by injection, whether say around the hips or the back and the spine to treat different conditions. So I do think we noticed a benefit with Traumeel. I think we noticed a much bigger benefit when it was done by injection, which is just a little more cumbersome. So we're going to put it in B tier, but we definitely use this and like this as well. Here we have Traumeel, which is another homeopathic formula. So this is designed for pets, sold in the US, and they have dropper and tablet options. I'm going to put this in C tier. We used it. I think it helped a little bit. I don't think it's as good as Traumeel. I don't think that's as good as some of these other things on here. But if you have the budget to have a large array of different things, this is definitely something that you can either give consistently or on an as-needed basis. When some of these other things and the other prescription medications you're on aren't enough for that day, you can add this in. And I think a multimodal approach where you're using a lot of these different things at varying doses along with other medications is really going to be the most effective. And here at the end, we have platelet lysate. So platelet-rich plasma, as a lot of you probably know, is where they draw your blood and spin it down a centrifuge, concentrate the platelets, and then inject it back into your body or your dog's body, using your dog's blood if it's your dog. Platelet lysate is going to be actually where they're taking blood from another dog, and then it's gone through a process at a lab of having those platelets broken open. And when those platelets are broken open, it's going to release the growth factors right when it's injected. This means it's going to treat pain, inflammation, all these other symptoms much quicker, and you're not going to have the post-inflammatory reaction that you'll usually have with PRP, which can be quite painful. So this would be an injection that you would do at your vet clinic and generally has to be injected quite deep into the body, into the joint. So this would be done under pretty heavy sedation. So this is a bigger procedure than everything else here on this list. It's going to be much more expensive than everything else on this list, but I do think it was quite effective. So we're going to put it in A tier because, again, much more cumbersome for you and your dog and your wallet than Adequan or testosterone, but it is still going to be very effective. So we're going to put it in A tier. You could also do normal platelet-rich plasma, stem cells. Other things like that would be in a similar category as this. In this case, it's not on that list because this list is only containing everything that we used with Sadie and Rui. Rui's still using some of these. So this list is just things that I've used personally with my dogs. Probably most dogs with osteoarthritis are going to need some other prescription pain medications as well, if not in the initial stages at some point. If they live long enough, non-steroidal anti-inflammatories are generally the first option there. Those were great for a lot of dogs. They're very effective for managing pain for dogs. However, they do cause a lot of issues with internal organs, especially digestion, so that isn't going to work well for all dogs. Sometimes gabapentin can help, even with osteoarthritic pain for some dogs. Amantadine can also be quite effective in managing osteoarthritic pain for dogs, especially as part of a multimodal approach. They tend to make other pain medications more effective. And there are lots of other medications that are used for osteoarthritis or just pain in general. So looking over this list, there's a lot of good options here. It's really just about figuring out what's right for your dog. If your dog has heart issues, that might be a contraindication for using testosterone. So again, it's just about talking to your vet, doing your own research, and figuring out what's going to be right for your dog. If you can afford it, generally the best option is going to be a lot of these things. Sadie, for example, was on Adequan, testosterone, herbs, some form of omega-3s, though not fish oil, Sigumir, Gotratik, CBD, Traumeel, Myo-Vet, all at the same time. Rui takes Adequan, herbal formulas, this exact Nordic Naturals, UC-2, Sigumir sometimes. He doesn't take CBD because he's been on Prozac. Myos and Hydrolyzed Collagen. It's just about figuring out what works for your dog, and that's not going to be the same if you have quite a few dogs probably. Typically, you probably wouldn't start with all of those things. You'd probably start with one thing and see how they do on it, and then slowly add in more things over time, unless your symptoms are really severe and you don't really care about knowing what's working because you just want to make them better. Then it's reasonable to potentially add more things in at the same time. But with our dogs, their needs changed over time, and so as their symptoms and their became worse and their osteoarthritis became worse, doing one thing like maybe Adequan and fish oil might have been great in the initial stages, and it would definitely slow down the progression, but it won't stop it. But after, say, a year, 2 years, 3 years, then that isn't going to be enough, and you need to add in more things. Typically, you're going to be adding in more and more things, and probably not removing nearly as many as you add in. So again, this is just my personal opinion on things we tried. If you tried all these things on your dog and you made this list, you could come up with a completely different answer, and neither one would be right or wrong. Hopefully you have a good vet that you have a good relationship with, that you can talk to them and work with them to figure out what's going to be exactly right for your dog. Try things, play around, add things in, and as long as your dog is doing good and their blood work is good, then great. I put a lot of links to these products or links to information about these products in the description. So if you want to know more, you can check that out, talk to your vet, and do your own research. Best of luck.